1. Understanding Raynaud's disease. 2. The body's natural thermostat. 3. Medical conditions and cold extremities. 4. Primary versus secondary Raynaud's, understanding the difference. 5. The crucial role of blood circulation. 6. Anemia, diabetes, and cold extremities. 7. Other factors influencing cold fingers and toes. 8. When to seek medical advice. 9. Conclusion: staying warm and healthy. Written by Dr. Emily Stone, reading level B2 or simpler. Style: use short sentences to make this more informative. Essay. Section 1. Understanding Raynaud's disease. Do your fingers and toes turn white or blue in the cold? This could be more than just a normal reaction to chilly weather. You might have Raynaud's disease. This condition affects the blood vessels in your extremities, particularly in your fingers and toes. When temperatures drop, these vessels constrict excessively, more than they would in a typical person. This restricts blood flow, leading to numbness, pain, and color changes in your fingers and toes. The affected areas might feel cold and prickly. Raynaud's disease can be triggered by more than just cold weather. It's not just the winter months you need to be cautious about. Stress is another common trigger. Emotional stress can cause the same reaction as cold weather. Even strong emotions can set it off. Anger, anxiety, or sadness can all contribute to an episode. During an episode, your fingers or toes may turn white, then blue. This is due to the lack of blood flow. As blood flow returns, they may turn red and tingle. This can be quite uncomfortable and sometimes painful. Raynaud's disease can be a nuisance. It can make simple tasks difficult and frustrating. In severe cases, it can impact daily life. Activities you once enjoyed might become challenging. Understanding this condition is the first step toward managing it effectively. By learning more about Raynaud's disease, you can take steps to reduce its impact on your life. This might include lifestyle changes, stress management techniques, and possibly medication. It's important to consult with a healthcare professional to develop a plan that's right for you. Remember, you're not alone, and with the right approach, you can manage Raynaud's disease and continue to enjoy your daily activities. Section 2. The body's natural thermostat. Ever notice how your hands and feet get cold first when you're chilly? This is your body's way of staying warm. It's a natural response to cold temperatures. When your body senses cold, it prioritizes. It focuses on keeping your vital organs warm. To do this, it constricts blood vessels in your extremities. This redirects blood flow to your core, preserving heat. This process is usually temporary. As you warm up, blood flow returns to normal. So, cold fingers and toes are often just a sign that your body is doing its job. Section 3. Medical conditions and cold extremities. While often harmless, cold extremities can sometimes signal a medical condition. Hypothyroidism, for instance, can cause coldness. This condition affects the thyroid gland, slowing your metabolism. This can make you feel cold all over, including your hands and feet. Peripheral artery disease, or PAD, is another culprit. PAD involves narrowed arteries, usually in the legs and feet. This narrowing restricts blood flow, causing coldness, pain, and even numbness in the extremities. Autoimmune diseases like lupus and scleroderma can also play a role. These conditions can affect blood vessels and skin thickness, contributing to cold extremities. Section 4. Primary versus secondary Raynaud's. Understanding the difference. Raynaud's disease can be categorized into two types, primary and secondary. Understanding the distinction between these two forms is essential for effective management and treatment. Primary Raynaud's, also known as Raynaud's disease, is the most common type. It is often less severe and can be managed with lifestyle changes and simple precautions. It typically appears before age 30 and has a milder presentation. Young adults and teenagers are more likely to experience primary Raynaud's, which can be triggered by cold temperatures or stress. The exact cause is unknown, but it's thought to be hereditary. If you have a family history of Raynaud's, you might be more susceptible to developing the condition. Secondary Raynaud's, or Raynaud's phenomenon, develops as a result of another medical condition. This form is often more complex and requires a comprehensive approach to treatment. These conditions can include lupus, rheumatoid arthritis, or scleroderma. Secondary Raynaud's is often associated with autoimmune or connective tissue diseases, making it more challenging to manage. Secondary Raynaud's tends to be more severe and appear later in life. Older adults are more likely to develop this form, and it can lead to more significant health issues if not properly addressed. Understanding the type of Raynaud's you have is crucial for proper management. Knowing whether you have primary or secondary Raynaud's can help tailor your treatment plan and improve your quality of life. Your doctor can help determine if your symptoms are due to primary or secondary Raynaud's. Through a thorough medical evaluation and possibly some tests, your healthcare provider can guide you towards the most effective treatment options. Treatment for Raynaud's can vary widely depending on the type. For primary Raynaud's, simple measures like keeping warm, managing stress, and avoiding smoking can be very effective. In contrast, secondary Raynaud's may require medications or treatments targeting the underlying condition. Support groups and educational resources can also be beneficial. Connecting with others who have Raynaud's can provide emotional support and practical tips for managing the condition. By understanding the difference between primary and secondary Raynaud's, you can take proactive steps to manage your symptoms and maintain a fulfilling lifestyle, even in the coldest of environments. Section 5. The crucial role of blood circulation. Blood circulation is vital for maintaining body temperature. It ensures that every part of your body receives the necessary warmth and nutrients to function properly. Without efficient blood flow, your body would struggle to regulate its temperature, especially in extreme weather conditions. Blood acts like a delivery system, carrying warmth throughout your body. It transports heat generated by your core to your extremities, ensuring that your hands, feet, and other parts stay warm even in cold environments. When you're exposed to cold, blood vessels in your extremities constrict. This process, known as vasoconstriction, reduces blood flow to the outer parts of your body, directing it towards your core to protect vital organs like your heart and lungs. This redirection of blood flow is crucial for survival in cold conditions. By prioritizing your core, your body ensures that essential organs continue to function optimally, even when external temperatures drop significantly. However, excessive constriction can be detrimental. If blood flow is too restricted, it can lead to discomfort and even damage to the tissues in your extremities. This is why it's important to balance warmth and circulation. This is where ischemia comes in. Ischemia occurs when blood flow is severely restricted, depriving tissues of the oxygen and nutrients they need to survive. This can cause pain, numbness, and even long-term damage if not addressed. Ischemia occurs when blood flow is severely restricted, depriving tissues of oxygen. In extreme cases, this can lead to tissue death and other serious complications. It's a condition that requires medical attention to prevent lasting damage. In Raynaud's phenomenon, this exaggerated vasoconstriction leads to the characteristic color changes and discomfort in the extremities. People with this condition experience episodes where their fingers and toes turn white or blue in response to cold or stress. Maintaining good blood circulation is key for overall health and warmth, particularly in your extremities. Regular exercise, staying warm, and avoiding stress can help improve circulation and prevent issues like Raynaud's phenomenon. By taking care of your circulatory system, you ensure that your body can effectively manage temperature and keep you comfortable in any environment. Anemia, a condition characterized by a low red blood cell count, can contribute to cold extremities. Red blood cells are responsible for carrying oxygen throughout your body. When this count is low, oxygen delivery is compromised, leading to coldness, fatigue, and shortness of breath. Diabetes, a metabolic disorder affecting blood sugar regulation, can also impact circulation. Over time, high blood sugar levels can damage nerves and blood vessels, particularly in the extremities. This damage can lead to reduced blood flow and, consequently, cold hands and feet. If you have anemia or diabetes, managing these conditions is crucial for improving circulation and preventing complications. Beyond medical conditions, other factors can contribute to cold extremities. Smoking, for instance, constricts blood vessels, reducing blood flow to your hands and feet. Certain medications like beta blockers can also have this effect. Nutritional deficiencies, particularly in iron and vitamin B12, can impact red blood cell production and circulation. These deficiencies can contribute to coldness and other symptoms. Being mindful of these factors can help you stay warm and comfortable, especially during colder months. Experiencing cold hands and feet occasionally is normal, especially in cold environments. However, persistent or severe coldness, particularly accompanied by other symptoms, warrants medical attention. If your extremities frequently turn white or blue, or if you experience numbness, pain, or sores, consult your doctor. These could be signs of an underlying condition requiring treatment. Early detection and management are crucial for preventing complications and maintaining good health. Cold fingers and toes are a common occurrence, often attributed to the body's natural heat regulation. However, They can sometimes indicate underlying medical conditions like Raynaud's disease, hypothyroidism, or PAD. Understanding the causes, symptoms, and potential implications of cold extremities empowers you to take appropriate action. If you experience persistent or concerning coldness, don't hesitate to seek medical advice. By staying informed and proactive, you can keep your extremities warm and your body healthy.